So when should someone expect to see the results from cataract surgery?
So with cataract surgery or lens exchange surgery, once we set up the focus of the eye and have the correct multifocal lens implant in and the correct focus achieved, then you should maintain that vision for the rest of your life. Now, there are a couple of caveats. Very rarely we see patients who the shape of their cornea changes a little bit over time. Now, what would happen there is the patient may notice a slight change in their vision, and if they do, then it's entirely possible for us to correct that for them. And if that happens certainly soon after the surgery, clinics usually actually do that for the patient at no additional cost. The second reason why your vision might change is that this ligament we talked about, which holds the lens implant in place, in about 10% of patients, this ligament reacts to the lens implant, and it's not a bad reaction, it simply is, it thickens a little. And what happens with patients feel they're getting a very slight mistiness of the vision, or their reading vision isn't as good as it was straight after the operation. And if that happens, it's a condition called posterior capsular opacification. Incredibly common, 10% of cataract operations it happens in. And very simply, the lens implant can be polished using a laser. It's not an operation. It's an outpatient procedure performed during your consultation. The lens is polished with a special laser, and it takes 2-3 minutes to perform, and that restores you back to where you were on the day after the surgery. So to say that your vision will fade away or become dreadful again 10-15 years after cataract surgery is completely untrue.